Role of a nurse during preoperative phase. What a nurse can do during the preoperative phase. So before that, let us see about surgery. Is a medical specialty that uses operative, manual and instrumental techniques on a person to investigate or treat a pathological condition such as disease or injury, to help bodily function or appearance, or to repair unwanted ruptured areas. So before the surgery, pre-admission testing should be done. Informed consent should be taken. Types of surgery: emergency surgery, urgent, required, elective, optional, and ambulatory surgery. Perioperative phase. It's a period of time that constitutes a surgical experience that includes the preoperative, intraoperative, and post-operative phases of nursing care. Preoperative, that is the phase before the surgery, intraoperative during the surgery, post-operative after the surgery. So these are the various roles of a nurse in the preoperative phase. Baseline evaluation, pre-admission testing. In the holding area, what a nurse can do. Preparation of the patient, preparation of the skin, immediate preoperative interventions, and attending to family needs.